The environment is a key determinant of health. Dr. Maria Nera.
Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle-related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it.
Hello, hello, hello. Greetings, Living at Your Finest Health Champions. Welcome back to the Living at Your Finest podcast show. Thank you for showing up today. I hope you and yours are all doing well. I am super pumped today for two reasons. This episode, I am going to be learning alongside you because we have a meaningful topic here that I have no clue about. We have the expert in the house that is going to share great stuff, great information. And this amazing guest of mine is my neighbor, my amazing neighbor, Neil Whittaker. I'm so honored to have him on the podcast today. So the title of today's topic is going to be Hidden Environmental Hazards in Properties, the Impact on Health and Finances. And the discussion is going to be tailored around finances, health effects, of course, loss of personal possession, and I'm going to say a few words on contamination with meth and fentanyl. So I'm really, really honored and truly excited to learn. But let me give you a brief introduction. So Neil Whittaker is the author of Hidden Hazards, a property owner's guide to detecting and avoiding meth and fentanyl contamination. He has been working in the environmental field over 28 years as an environmental tech, cleaning up hazardous waste spills, emergency spill response, and a whole lot of waste disposal lab packs. Oh my goodness, he's done a lot of great work. He's also project manager of the government contracts for DoD and DOE for disposals of hazardous and radioactive waste. So without further ado, let's give a warm welcome to Mr. Neil Whittaker to the Living at Your Finest podcast show.
Thank you for having me. I really appreciate it.
Yes, I'm truly honored that you're here, and thank you so much for wanting to just share with the community what is essential for healthy living and for your book. Congratulations on your book. I have gone through a few chapters and I was really empowered and enlightened. So I want to start off by asking you, why this book? What got you into this space? What's the passion behind it?
Sure. In 2004, I got certified to sample and clean up meth contaminated properties in the state of Tennessee. It was a new law that got passed, and you had to have a hazardous waste background, which I'd been working many years in disposing hazardous waste, hazardous chemicals. And I just became a landlord. I had my first duplex and maybe one or two other small rentals, and I was kind of concerned about the new law that was coming into effect that sheriff could come in if they found that you were using meth, cooking meth. They could quarantine your property, and nobody could use or step foot in that property till someone like myself was a certified methamphetamine hygienist that would come in and sample, and each room had to be under a certain state limit before we could declare that property fit for human habitation and let another family move into that property.
Okay. So yeah, so it all started off from just wanting to make sure that you do things the right way, and then that was how you expanded to where you are today. Yeah, so very good. So can you give us some just, what is the background? Why is this so important to you? What do we all need to know that we don't know?
Sure. It's really important to me because babies and children are most affected by being contaminated with methamphetamine and now fentanyl in these properties. Babies and children, as you know, put their fingers in their mouth up to 1,000 or more times a day,
Yeah.
and they can get really sick. And what a lot of people don't know is because you don't see it in the news a lot, but I saw a statistic from DEA that really, really affected me and got me thinking about this. 1 in every 10 houses is possibly contaminated with methamphetamine.
Wow.
Now, meth has been around a long time in California. It's been around since the 60s. On the East Coast, it's been around since the late 90s. And I've cleaned and sampled well over 1,000 properties, and 9 times out of 10, I'll walk in these properties, and you would never know there's meth there. There's no smell. There's no residue. It looks like a nice apartment. But when we take samples, and sampling is the only way you know if it's there or not, we'll find high levels of meth. We've been doing meth properties for over 20 years. Fentanyl has been on the scene for 5, 6 years, something like that now.
Okay.
And a lot of drugs coming on the market are also the drug dealers will put fentanyl in there. And fentanyl, for a few years there, was the #1 killer for 15 to 45-year-olds in the United States. And if that doesn't make you scared, this is a very scary statistic. You think of cancer, trip and falls, car crashes. No, it was people dying from fentanyl. So, and there's not one state in the United States that has any laws for properties contaminated with fentanyl. Methamphetamine, about half the states have a law where you have to do something if meth contamination is found, but zero states have anything for fentanyl contamination.
Oh my goodness, that is that's scary statistics that you just outlined there, and especially with children crawling, and not being able to smell it unless it's sampled. So I guess for people hearing this and want to grab your book and learn more, what would be, I guess, the next step? Because I think this is important for not just pediatricians to be aware of, but also primary care doctors. But what will be the first step? What would you encourage? Like maybe, a property manager as yourself, or maybe a homeowner. Like, I live next door to you. Do I need to be calling someone to come and check my home? What do you advise us to do as a community? I think there's several layers. So I'll allow you to, educate us on what it is that we need to do.
Sure. I think the biggest step is if you're looking at buying a home or renting a home, hiring someone like myself, a company that does the testing and the cleanup can be very expensive. But you can go on Amazon and purchase an instant meth kit or instant fentanyl kit, 20, 30, $40, and sample your house and know if you have a potential problem. The #1 spot I recommend sampling is the return. If you've got 2 AC units, you're going to have 2 returns.
Okay.
And I recommend sampling each return and just seeing if you get a positive hit for methamphetamine or fentanyl, and know that before you move your family into the house, before you move all your personal belongings. Once it's in the house and it's in the ductwork, it just kind of keeps recycling. So if
Okay.
you've got clothes in there, if you've got couches in there, furniture, it all kind of just kind of keeps getting recontaminated. So once you've moved into this property, not knowing that it's possibly a meth or fentanyl house, you've got a lot of financial problems. You've got a lot of health problems that could possibly come into play. And once it's in there, it gets a lot more expensive. If you handle it before you move in, not near as expensive, and then you don't have the emotional or the health concerns
Yeah.
before you move in.
Yeah, thank you for sharing that. And so let me unpack what you just said. So
Sure.
certainly prevention is better than cure, right? So before you buy a property, whether renting or buy, definitely and just make sure that the house is in the clear, right? So mint, fentanyl, you check. And if it is contaminated, it's best to take care of that. I'm curious about who would they contact? Would it be someone like you? Who would they contact if they find out that yes, this house is contaminated? That's the first arm of the question. And the second one I was going to ask was, if they're already in, they've moved, they've done all the things. what if they have done the sample and they see that it's there? Does it mean all hope is lost? Is there anything that they can do? So those are two arms of questions, the first and the second.
Sure. Once you move in, it's always more difficult, but
I see.
it can still be cleaned up and
Okay.
decontaminated. Like cloth, if it's high contamination, if you got like a carpet, padding, your furniture, couches, paper, there's not much
Okay.
really we can do to clean those up because it gets so embedded in those type materials, and you've got to use water and then cleaning agent. But if again, if you're after you before you move in, if you haven't sampled, you might get a good deal on a property, or you might just decide to go check out the next one in line and not mess with it.
Oh, I see. Okay, got it, got it, got it. Yeah, and it's just got me thinking, in this day and age, there's so much environmental toxins that this could be why we're having a lot of, I don't know if you're familiar with all these like POTS, all sorts of MCAS. These are autoimmune diseases that our children are having, where somebody will just stand up and they're dizzy. You have no idea. You check all their blood work and everything is negative, meaning it could be coming from their home. Just while they're home, they're having the symptoms. When they're out, because when I see patients in the clinic, I always want to know, where are you having these symptoms? Is it in the house? Is it outside? Is it in school? I'm seeing a lot of patients. So maybe that's what's going on in the home. It might just be that it's contaminated, and that's why you have all these bizarre symptoms that you can't see, right? So it just made me think that, I think the awareness needs to go into like the pediatricians' offices and doctors to be aware that there is still the home environment that people need to check and see if that's where the corporate is, where the root cause of problems are coming from.
Sure, and all the case studies that I've read, especially for meth, fentanyl is a little bit newer, but if people move out of a house that's contaminated, lots of times they'll be getting dizzy, they'll have rashes, a lot of paranoia
Yeah.
associated with these houses, and lots of times that goes away pretty quickly when they move into a different
Once they
environment.
move into a different environment.
Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, please subscribe to iTunes if you have not done so already, and share the podcast within your circle of influence. An extra step? Leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode.
Do you have any, does this, I know mold is a different beast, but is it anything around, does it also worsen mold in the home, or no? They're just two different things.
Two different things, but the problem is, and I kind of go through this in the book, how you should clean up a house contaminated with meth. I highly recommend professionals do it,
Okay.
but homeowners should have an understanding how you should do it, just so when they're talking to these contractors, they have a basic idea. Some contractors, like myself, we'll go in and spray detergent on the walls, ceilings, floors, and we'll scrub it with a brush. It's really labor intensive jobs.
Mm.
A lot of times your big companies will actually spray the detergent on the wall and pressure wash with a low pressure washer system. And if you don't have a way to get all the water out of the property, and now instead of just having a meth or a fentanyl house, you'll have a mold house.
Yeah.
I'm certified in mold. 24 to 48 hours is when mold starts growing in the house, and if you don't get all the water out of the house, then you will have a mold house on top of a meth and fentanyl property.
Just make it worse. Well, listeners, you're all hearing this. Don't go start doing that on your own because you don't want to go from, making matters worse. So definitely you want to contact experts like Neil to take care of this for you. Well, I would definitely like to hear you shared about the health, problems, but you also alluded to the financial aspect of it as well, right? Because if you don't take care of it from the very beginning, then it can become even a financial burden. So I guess in closing with you, I want you to give us more information about how can we reach out to you. We need your services. How can we get your book? Because this is so empowering and enlightening. And I think a lot of people that sell homes, I guess in the business realtors, they need to know about this too, right? Because they are the ones showing homes. Because when we bought our house, I don't remember anyone talking about this. I don't even remember anyone referring to it. So I think we need to expand this, especially for me as a doctor, because I'm seeing all sorts of syndromes that I don't remember being taught in medical school, that unexplained issues. And then when we look at their home environment, that is where their symptoms are triggered. So yeah, I definitely would like for you to share more about how our listeners can get in touch with you and learn more about the work that you're doing.
Absolutely. My company name is Property Decon Pros. I'm located here in Marietta, Georgia. I work the whole Southeast, and everywhere from the Carolinas down to Florida. And like just last week, I did a job in New York City. It was for crime scene cleanup, a little different, but the national contractor got a hold of me and said, "Would I travel to New York?" And I said, "Sure." Here's what I need, and they bid it out. My price was still well under the competitor's price, so they went with me. But that's one thing. If you go with a small business, you don't have like a lot of the overhead that a big company will have. You just need to check your resources, maybe review them, make sure they know what they're talking about, and get you a few bids. And then if you got questions, I like to talk, so you can give me a call, and I'd be happy to answer any questions. Georgia has no laws for methamphetamine. Again, no
Okay.
state has laws for fentanyl. And lots of times, realtors, the property managers, they have no
They
idea
have
about
no
this,
idea.
and it's really a double-edged sword. If you're a homeowner and you're like, well, maybe I'll just sample it if it's hot, and you're doing the right thing, but now you're going to have a big expense getting it cleaned up. And the one bad thing about meth and fentanyl is 9 times out of 10, insurance agents will not help to pay for the cleanup or the
Oh, really? Hmm.
and to fix your property back up. The sheetrock repair, the new carpet, the painting. They lots of times will not pay for that.
Okay. Well, thank you so much for doing this work. I mean, you have enlightened me today, and I'll definitely keep my ears out and definitely send people your way because this is so important about our health. All sorts of autonomic dysfunction is happening in our environment just because we're not even aware. And it's interesting to hear that we don't even have those laws here in Georgia. So thank you for being so diligent in doing the work and writing the book about it. I think in the next few years, things are going to change where it's going to be at least if there's no law, but people are aware realtors, they will say, well, let's contract out, let's make sure before you move in, and that could make a difference in the home. And if people are losing homes to sell, then they would make sure that it's not contaminated. I think that might be what we should foresee in the next few years.
Yeah, there's just so you know, there's recommendations on the federal level for methamphetamine, and those recommendations have been around probably 20 years. And recently, they just added the word fentanyl to the cleanup standards for the methamphetamine regulations. So they're similar, but there are a lot of differences between the two drugs. Fentanyl is a lot more dangerous.
Yeah, yeah.
4, 5 to 6. Like if you took a salt shaker and had fentanyl sized cubes of salt, 6 to 10 pieces of salt, which would be fentanyl, would be enough to possibly kill you or take your
Yeah.
life. It's a really scary situation.
It definitely is, and it has no business being in the home where we spend majority of our time. Well, I mean, I know kids are in school and, games and stuff, but I mean, you're going to come home and sleep, right? So it's important that we are aware. Well, thank you so much for sharing this. Now we want to move into another exciting segment of the podcast, and this is where we get to know Mr. Neil as an individual. I know you're a fun person. I know you like to help. I know that personally, but we are curious. In terms of the podcast, it's titled Living at Your Finest. So can you share with the audience what makes you live at your finest well-being? Some I might know. I don't know. I know you like to travel, so maybe don't mention travel.
Yeah, yeah, yeah.
Except traveling, because I know that's your happy place. So anything else but traveling, what makes you live at your finest well-being?
Sure, sure. I guess from college, I put myself through school. Time I got out of school, I was 50 grand in the hole, and you know, nobody would hire me because I had no real world experience. I was waiting tables, I was bartending, and finally took a non-degree position. And in the environmental field, it was cleanup of spills. Like a tractor trailer would have a wreck on the interstate, we'd clean up all the diesel fuel. It was really hard work. You're dressed out in all your PPE,
Mm.
and I was making like 750 an hour, and I was like, man, there's got to be a different way. And so anyways, I got smart. I started buying a few rental properties, and worked really hard for 15, 20 years. And now I work kind of part-time, and really I try to enjoy my life. You had alluded to travel. Me and the wife and daughter like to do a lot of traveling. I love fishing. Uh,
Fishing, yeah,
love
very
little
good.
dancing here and there. I love
I
eating in the
love
nice
that.
restaurants in Georgia and around the world. I love food. Trying to lose a little
Right.
weight right now. Maybe I need to have a consult with you on losing some weight, a little healthier.
Yes, I love that. Well, yes, and I know you like to take care of your lawn. You do a really good job. And then my dog likes to bark at you, which Duke is on his own level. But yeah, but thanks for sharing that. Well, I have two more questions for you, if that's okay. So, what
Sure.
is one word that describes you?
Uh, Hard-headed, I would think.
All right, hard-headed. Well, you're hard-headed for a good reason. I mean, look at that. Your journey in life to work your way through school, everything that you've accomplished. I think it's a good word that suits you right. So, last question. Let's see. What's the last question? What's your favorite? You already said that you like food and all. So I was going to ask you, what's your favorite restaurant or food?
Oh man, it's so hard to narrow her down. Really, I mean, I'm assuming you're
Like
talking
if
about
you could only eat one thing for the rest of your life, what would it be?
probably lobster.
Lobster. Okay,
Yeah,
that's
yeah,
cool.
love lobster. We go to Belize a lot, and we catch lobster, and instead of having one or two, we'll have 6 or 8 at a time, and it's so good. You grill it up on
Nice.
the grill on dried coconut husks, and man, it's just delicious.
Fantastic. Well, thank you once again. Really enjoyed this time with you on the podcast. I don't know if you have any parting words for the listeners, but certainly I want to thank you and want to give you an opportunity for parting words.
Yeah, I forgot to mention the book, which should be out in a week or two.
Okay.
It'll be on Amazon and Google. You can buy it, the book, or you can buy audio if you like to listen to it in your car or whatnot. And that's one thing I didn't touch into. It's kind of another scary phenomenon with these drugs. Is last 2 or 3 years, I've sampled over 100 cars
Oh, cars. Uh-oh.
for rental agencies that had the car stolen, or people that had the car stolen, and they found drug residue. And when we sample for meth or fentanyl, if it's very positive, scary phenomenon. They just send it to auction with a bio sticker. There's really no regulations for it. So you're going to auction thinking you're getting this great deal on a car, and
Oh gosh.
might be contaminated meth or fentanyl. What we have to do to clean it up is get rid of all the seats, the carpet, the ductwork, and insurance companies said it's just too costly. So they'll just sell it at auction. And so again, I just recommend maybe get an instant sample kit.
Yeah.
AccuMeth, they do the instant sample kit's really easy to use.
Mhm.
And my website, methcleanupcrew.com, or
Okay.
in the book, there's a 10% discount for those
Awesome.
kits.
Awesome, awesome, awesome. I'm so glad you mentioned that. And I'm going to make sure that I tag you and in the show arts, your, links, everything that you shared so that, listeners know how to get a hold of you and get in touch with you. But thank you so much. This has been great. I've learned a lot. Like I said, this is an area I have no clue about. So thank you for coming on and sharing with each and every one of us. And yeah, so to the listeners, again, this is all about empowering you to live at your finest well-being. You've learned now it's not to scare you, but just to, make you know what to be aware of, right? So prevention is better than cure. You're going to have Mr. Neil's contact, reach out, and let's make sure that we live in a healthy environment. So until next time, I want you to remember that you deserve to live at your finest because you are worth it. All right, make sure you share this episode with others. It's worth listening to. All right, take care. Until next time. Bye bye.
Thanks for having me.